Good afternoon. We're going to be talking about the diagnosis and treatment of cystic fibrosis. Through this video, we're going to be going over what is cystic fibrosis, symptoms and causes, risk factors and complications, diagnosis, and treatment. So, what is cystic fibrosis? Cystic fibrosis is a hereditary condition that affects the cells that make mucus, sweat, and digestive juices. It causes these secretions to become thick and sticky, plugging up their pathways, particularly in the lungs and pancreas. The cause of cystic fibrosis is a change in the CFTR, cystic fibrosis transmembrane conductance gene, which is passed down from each parent, making it a hereditary disorder. Symptoms are organ-specific. So respiratory systems could include a consistent productive cough, wheezing, fatigue, repeated lung infections, irritated swollen nasal passages, and repeat sinus infections. Digestive systems could be foul-smelling, greasy stools, poor weight gain, poor growth, blocked intestines, which is more common in newborns, or constipation that is ongoing or severe. The major risk factor of developing cystic fibrosis is a family history of the disease. Complications are organ system specific, so respiratory complications include respiratory failure, damaged airways, ongoing infections, nasal growths, coughing up blood, and a collapsed lung. Digestive complications include poor nutrition, diabetes, liver disease, intestinal obstruction, and DIOS, distal intestinal obstruction syndrome. Reproductive complications include male infertility and low female fertility. And other complications could include thinning of the bones, unbalanced electrolytes, dehydration, GERD, which is gastroesophageal reflux disease, mental health conditions, and risk of digestive tract cancer. The diagnostic procedures for cystic fibrosis include newborn screening, where a healthcare professional takes a few drops of blood from a newborn's heel and sends it to a lab, which then checks the blood sample for higher levels than expected of a chemical called immunoreactive trypsinogen, or IRT, which is released by the pancreas and may suggest cystic fibrosis. The next test would be a sweat test, which can also be done on a baby that is at least 2 weeks old. The chemical that causes the skin to sweat is put on a small area of skin. That sweat is then collected and sent off to test to see if it is saltier than typical. And then the last one is genetic testing. Most healthcare professionals may also recommend this form of testing to look for specific changes in the gene responsible for cystic fibrosis. It may also be done along with the test for IRT levels to confirm a diagnosis. When going through treatment for cystic fibrosis, your healthcare provider will have specific goals, including preventing and controlling lung infections, removing and loosening mucus from the lungs, treating and preventing intestinal blockage, and making sure that you're getting enough nutrition. Medications prescribed to those with cystic fibrosis could include ivacaftor, which is a CFTR potentiator that increases productivity of the CFTR protein at the cell surface to improve lung function, also known as Kalydeco. Aztreonam, which is a monobactam antibiotic used to treat lung infections associated with cystic fibrosis, which could also be called azactam and casein, and pancreolipase, a mixture of digestive enzymes used to treat EPI, which is exocrine pancreatic insufficiency, which is caused by cystic fibrosis. This could also be known as crayon, pancrease, Pertzai, Viacase, and Zenpep. More severe cases of cystic fibrosis might need surgical intervention. The surgical procedures that could be done include nasal and sinus surgery, oxygen therapy, non-invasive ventilation, a feeding tube, bowel surgery, and lung and liver transplants. There is no cure for cystic fibrosis, so early intervention is key for proper symptom management and ensuring the highest quality of life possible. Thanks for watching.